but also as a region, as Africa. And one of the biggest things they are doing that they'll be supporting the rest of these with is contract manufacturing. And that's what we've been missing. We do a lot of science in the laboratory, but we miss out on the end-to-end. We reach somewhere and our prototypes cannot proceed to the next level because we don't have manufacturing. Yes.
These are drugs.
So here is the drugs we manufacture so far. So we have tramadol, which is a painkiller restricted one. We have paracetamol. For now, tramadol and paracetamol, they have pending approval, so they are not yet in market. But we have also antibiotics here. We have doxycycline, which is this one.
You can hold one and show us.
This is doxycycline. It's an antibiotics. It is already on market. Also, we have metformin. This is for diabetes type 2. It's already on market. We also have metronidazole. Metronidazole, we have two of them. One of it is non-coated, another one is coated. The difference between that is that the coated one masks the bitter taste, but also it is a little bit, takes longer to act than this one. It is sour, but the absorption is faster. So they are all on market.
So which one this is bioactive?
Bioactive? What do you mean by that?
We think they are producing bioactive drugs, the ones that are...
They have a lot of different mice. This particular mouse is special in that it is able to mimic the human body when it comes to COVID. It is they inserted human genes in it, so it can get infected with the COVID, and it behaves like a human being who has COVID. So if I want to test whether my vaccine works, what I do is I vaccinate this rat. Instead of first coming to test it on you, I vaccinate this rat, I infect it with the COVID. If it's protected, then I know my vaccine works. So they can tell you the rest of what they do, but this is a whole industry of its own. And for us, we need to have people employed in this sector. We have a few people who produce the lab mice we use. You've seen Minister of Education can set a whole exam with rats to dissect. So there are people, that is very, very basic. But now, not only are we have a state of the art, because like these ones, we have to maintain them for a long time. And we have these different ones. You see, all these are clans of mice. All these are different clans. Some of them we have to maintain them in a very clean environment. They never get exposed to any infectious agent. So we didn't have this facility, and so we started to set up this facility in 2020, and now we have started training people to actually, these ones we had to buy from out, then multiply, because they reproduce, but we are now creating our own for diseases which are here. And we start to create a model for malaria, a model for, so that when other people need, because like when we were looking for this one, we first requested it from China. After 6 months, they returned our money. The demand globally was too much. So then we ordered from America. It took another 6 months for us to get because of the line. So it's a lucrative industry, and we are going to be training a lot of young people to do this, to fit in that ecosystem.
Platform program. For long, we've had our indigenous scientists that most of us call herbalists doing their work, and very good, and we really, really hail them because they've showed us actually what innovation can do, and they've taken products to the market. However, we've been missing an element of standardization. So when we came in as STI, we set up a whole platform to support the standardization of their products. For example, they will work on a product maybe for malaria, but we've not tested in the animals like you've seen, and right away they are getting into the humans. And we never get to know what those drugs are doing to the lungs, for example, to the heart, to the organs. Yeah. So before we now come into humans, we've tested the other side in animals, in petri dishes, like you'll see, and then finally, when we've gone through safety is the very first level before you go into the next levels. So this platform here is now handling testing in humans after we've done in animals and in the petri dishes. So this great team here, headed by Professor Chirenga, you saw him on Monday during the summit, has already done 2 clinical trials of therapeutics from natural products, things we had never done as a country. So very recently, the recently concluded clinical trial was the one for Vidicin. This is from Kazire. Kazire is a renowned businessman, but he trusted the process in order to bring his product. You know, in science, it can be a negative or a positive. But he said, whatever it is, I will go. So he gave us his product, and then
it works very well.
And it works very well. This was phase 2B. Yes. And so we are now waiting on National Drug Authority. There are processes there, but at least on our end we've done the science and we've gone to another level. So thank you. But this is huge. We've registered it on the Africa Clinical Trials platform, and we are going on. Actually, World Health Organization came here to learn from us as a country and how we've been able to handle this. Now we are getting into cancer clinical trials, you've seen Pombegard pain, or what we call analgesics. We are getting into malaria clinical trials, very expensive diabetes, but STI, championed by the minister, has held this on. Yeah. What is in vitro? Before we test, like we've said, any drug, even a vaccine in the body, we want to first see still preliminary safety, but also is this drug able to do whatever we are claiming it is able to do. So the indigenous scientists or the herbalists that we talked about earlier have been doing their work. Yes, they've tested to a certain level. They've known this component, this one treats this, but we've not gone to that detail of seeing is actually the drug doing what it is claiming to do. So this facility was not there when we began in 2020, and the minister actually championed its starting at the Uganda Virus Research Institute. So we set it up, and right now as we speak, we've tested over 60 scientist products funded by government. Your work is to bring your product, malaria, cancer, whatever product, and we test it in here. So we test it on the cells, we grow cells, test your product there, and then we are able to see if it's working. Other than just saying this product does this, we demystify those claims. Products being supported by Conat, being supported by the other team. Conat, you have to explain louder. What I have
That's louder.
and aflatoxin. What I have with me is an aflatoxin biosensor that is used to measure the concentration of aflatoxins in food samples. So aflatoxins of different kinds. We have the B1s, the B2, the M1, and these are actually poisonous and can cause cancer.
And they are so ubiquitously present in most of the food which we have, and they are poisonous to us. I think you heard the president talking about it in Grand Nuts.
Grand Nuts, yes.
Yeah, so this is a health safety intervention. So what are you developing?
So our device is able to measure the concentration of aflatoxins B1. B1 is mostly common in cereals, like she said, the genus and the maize. So if you have your food sample and you soak it in ethanol, right? So that solution that we get is what we use. So you dip this into the solution and you turn it on.
And it will tell you whether your granules from a winner are safe or not. Appreciated the scope of this.
Maybe the vaccine side.
So many of these you'll come and see at your leisure.
That is something in animals you've been seeing humans basically, but this is Bishop Stewart University. They are doing a host of things being championed by this lady, Chocho, has been Chocho in Adelaide.
Can you show?
I'm a lecturer and an innovator and a researcher at the same time, and this is the product we are talking about, spermicide.
Oluvannyuma lw'okulaba demand ey'amaanyi nti abantu baffe bagenda ne banywa omwenge enkeera ne bataba productive tebatasobola kuba nti basobola ogenda okukola emirimu sekendere n'embeera y'ebyobulamu byabwe nti abantu bangi bafudde olw'omwenge mu nsi yonna si Uganda yokka naye mu nsi yonna abantu bafa olw'omwenge so twalaba demand nga weeri ne tutandika okuyiiya ekintu kino bwe natandika okuyiiya ekintu kino ne tukola prototype nejja bannayuganda ne bagisanyukira nnyo n'ensi yonna ne tugenda mu maaso n'okudevelopinga product eno scientifically era we twogerera etuuse ku market yawe eri ku so eno product twagituuma Pombegard okuyamba nti etangira omwenge obulabe bw'omwenge bwonna obwandikutuusiddwako ng'onywedde so that's why twagituuma Pombegard mwe twajja erinnya eryo y'abantu bafuna hangover bw'oba onywa n'ofuna hangover wano we tuli eno ye solution gye weetaaga teweetaaga kirala. Painkiller eno we twogerera egenze mu clinical trials tugenda kubanga tukola trials zonna testi zonna mu mmese ne mu bantu naye kyensobola okugamba ku painkiller eno abamanyi morphine nga bwakola eno eri stronger than morphine painkiller eva mu njaga eno eva mu mmere kyekyenjawulo etta obulumi instantly mu ddakiika 5 eba emaze okugyawo obulumi ate n'ekikola mu ssaawa ezitaka wansi wa 15 ye painkiller eno gye bayita Painato etta obulumi mu ssaawa ezitaka wansi wa 15 ate n'ekikola instantly mu ddakiika 5 eba emaze okutta obulumi kati morphine abaddewo mu katale k'ensi konna ng'akolayo essaawa 5 n'omira dosage endala kyekyenjawulo ekiriwo kweno painkiller.
Abannayuganda basomeredde okumaliriza
so far bannayuganda tubalazeeko nti tusobola okukola ebintu ebirungi kati era ne tubituusa ku mutindo kati nga Pombegard ye awedde buli kimu trials zonna ezeetaagisibwa ziwedde ogenda ku world market era ye weejogerera kati shipping zinaatera otandika to exporting Uganda efune sente gavumenti yaffe esobola okuweereza bannayuganda ng'erina sente kati mu Painato bwe tunaamala ekyo tulina abalwadde ba kansa bangi abakyala batawanyizibwa menstrual pain ezo ab'emigongo bonna kye baba basuubira n'ekirala ku economy tugenda gatta ku economy twagala kutandika ku exportinga malagala nga bw'olaba India, China, European countries bwe zikola zifunye nnyo mu science kyakulwanyisa kyabwe so naffe bwe tuba ne products nga zino abazungu ze batasobola kutuukiriza bulungi nga ffe sobola zituukiriza ku mutindo gw'ensi yonna tujja funa sente we only need science okubanga funa sente tetwetaaga kirala kyonna. Katale sente ejja kuba ya muntu wa wansi okusobola okuyamba abantu bonna gibale ng'eccupa ya bbiya sente z'ogula eccupa ya bbiya ze zigenda okugula Pombegard weetaaga ka Pombegard kamu kokka for night kamu kokka bwe kati for night onywe simatire enkya bukye ogenda okola emirimu gyo ng'obulamu bwo protectinze then n'emirimu gyo otuukiriza obuvunaanyizibwa bulungi. tukubiriza bannayuganda nti bw'oba onywedde omwenge tovuga kubanga pombegadi bw'onywa omwenge ne bw'oba omukozesezza ojja kunywa otamiire naye hangover gy'otaafune. Tagaana muntu kutamiira, onywa n'otamiira hangover gy'otafuna. So pombegadi n'ekirala si ddagala wabula kirungo kya mmere. Si ddagala wabula kirungo kya mmere. It's a dietary supplement. Kwongereza ku birungo bya mubiri gwo. Ya. Nedda. Weetaaga kapombe gadi kamu kano ofune ekiro ekirungi. Kyekyokka. Bampita Aaron Kalyango ye muyiiya wa pombegadi ne Peinato Ana Jessica.